Welcome to the Black Belt Nurse Podcast, where we discuss all things related to violence in healthcare. I'm Bill Schuler, your host, and this is the place where we learn together, mull things over, and generally figure things out. Whether you're a seasoned expert, a student, or just passionate about safety in healthcare, this is the podcast for you. Before we dive in, a quick disclaimer. We do discuss all aspects of violence in healthcare, some of which may be inappropriate for younger listeners and viewers. Please use discretion. The Black Belt Nurse Podcast is for informational and educational purposes only. While we discuss experiences, strategies, and science, this podcast does not provide medical, legal, or professional advice. Always consult your healthcare institution's policies and guidelines or seek professional advice when necessary. And of course, all opinions expressed here are my own and do not represent any employer or organization. Now, let's get started. In this episode, we will continue with part 2 of discussing the question, is violence part of the job? So in the first episode, we reviewed the 3 questions that were posed in this study. The first question being, do you think it's possible to prevent violence in hospitals and achieve zero? And 15% said yes, 85% said no. The second question is, do nurses in acute care facilities expect to be exposed to violence while at work? 81% said yes, and 19% said no. And the third question, should nurses in hospitals expect to be exposed to violence while at work? 32% said yes, and 68% said no. Let's dig into the discussion of the questions as well as what nurses also wrote as considerations for the responses to the questions. The first question was, do you think it's possible to get to zero and prevent all episodes of workplace violence? Let's dig into what the people who responded yes said. They talked about leadership support. They felt that it was a leader's responsibility to prioritize staff safety and not necessarily patient safety. They also mentioned getting away from patient satisfaction scores or ratings and should worry less about that. So within that, they talked about staffing. They talked about adequate staffing. They thought that the setting could be controlled enough, for example, with low nurse-to-patient ratios, as well as making sure they have enough ancillary staff. They also talked about having enough security and having a strong enough security force that the employees felt supported and safe by their organization. Another large topic they talked about is staff training and behavior, and that included de-escalation and situational awareness. They felt that they needed more education to keep themselves safe in situations while being mindful of their own role in escalating situations. And they also felt that training on how to take care of psychiatric patients was not very well done. They also talked about early interventions, recognizing warning signs of escalating behavior. They also talked about how some physicians were very lenient and not good about medicating patients before they became violent. They also talked about situational awareness, that patients often escalate when their needs are not being met, their physical needs or psychological needs, and this could be controlled by earlier intervention to prevent violence. They also talked about the patient aspect, that sometimes people choose not to make the right choice, and it would be up to the patient to be decent, especially when they're encountering situations that the staff can't control either. And also, if there were consequences for their behavior, they mentioned assault is assault no matter what the profession, and patients who are violent need to be held accountable. And they talked about also behavior contracts, and they shouldn't be coddled, and any instance of violence or threats should be reported to police. Now, let's break that one down a little bit more. In my experience, behavior contracts have fallen out of favor. Like, we expect you to have such and such behavior, not do this. And if you do, there will be a consequence. You might get kicked out or whatever. We find that those really have no teeth. There's really no way to enforce those. And those can be coercive, meaning that the healthcare facility has all the power and you can remove some agency from patients that way. So, talking about behavioral contracts, and we know that all instances of workplace violence are not reported to the police. The vast majority of them are not. There's many reasons for that. It could be it's considered as a waste of time, a waste of resources, nothing's going to happen. And law enforcement can even actively discourage staff from reporting. So there is room for accountability for behavior, especially those who know better. But also, we have to think about there are plenty of patients who don't know better. So, this is where you get into a conversation about intentionality. Did they mean to do it? Did they know what they were doing is wrong versus they didn't really know? And in my experience, when we know and identify that a patient really didn't know what they were doing, that wouldn't even get reported to law enforcement and probably won't even have a workplace violence report submitted internally anyway. So that is for the people who said yes, that they thought that workplace violence could be prevented and it could get to zero. Now let's dig into what were some of the responses for those who said no. They talk about patients are human. Patients are sick. Patients are hospitalized. They're unpredictable. They have a disease process that they come in with, and the violence could be a part of that. And you have to treat their underlying condition. And they talk about we cannot control people, not their emotional or psychological states, nor can we control their triggers, which is true. They also talk about the variety of sources for why people could be violent. And we talked about these earlier in the previous episode. And that can be dementia, psychosis, delirium, encephalopathy, traumatic brain injury, strokes, tumors, substance intoxication and withdrawal. You've got also responses to fear, stress, and pain, and bring those together. It creates an opportunity for violent or agitation. You've got delirium. You've got infectious process. And for example, it usually is the elderly person with a urinary tract infection. You can get untreated mental illness. And they say, you will never be able to get rid of this. So therefore, potential for patient violence will always exist. The statistics would show that that statement is true. They also talk about patients choose to be violent. They talk about violence exists in society at large. There are people that have more of a proclivity to violence. How they're going to behave outside of hospitals is usually how they're going to behave in a hospital. They say some people are just mean and think they can be violent, sexually inappropriate, verbally inappropriate towards medical staff. They're exercising free will and they can choose. Violence as a form of communication, and people feel a sense of entitlement. They also go on to say we can't prevent it, but we can mitigate it. They talk about we can improve our prevention strategies, but we really can't control people's behavior. Somebody said, although ultimately I think harm to staff can be mitigated, it is unrealistic to expect patients to never react in a violent way. They talk about mitigating the effects by training. They talked about they believe there will always be situations that cause people to act out in a verbal or physical manner. I do believe training staff to mitigate these situations could decrease the severity and or minimize the incident. So from what I hear from that is that there is hope that you could decrease it, but you're not going to get to zero. So that is this more detailed response from staff addressing the question of, can we really eliminate all violence and get to zero? The second question is, do nurses in hospitals expect to be exposed to violence while at work? And remember that 81% said yes and 19% said no. For those people who answered no, this is interesting because they said, I don't think any of us expect it. We know it could happen though. Someone else said, I know it happens, but I don't expect that it will happen. So you're aware that it happens, but you don't think it'll happen to you. Someone else said, I don't think it's expected to happen to everyone. So what you're saying is it'll happen to some people, but I do think it is expected for it to be possible. This is not something we anticipate happening. I think it's a big shock for new nurses, someone says. Well, then that means we just haven't done a good job of prepping the new nurses or even talking to them in nursing schools, because if they're surprised that it's happening, we've set them up for failure, essentially. They go on to say no one should come to work expecting to be exposed to violence. One nurse says that I come to my job with the expectation that I'm going to be safe at work. I mean, this is fair. This is true. Another one said you shouldn't expect to be exposed to violence at any other job. To me, as a nurse, it's not expected either. Other nurses also said, we talk about we're here to provide care and being on the role as a caregiver. We're here to help patients and families. Nurses go to work with the intent of caring for people. And there was an underlying assumption that the intent to help would prevent patients from exhibiting violent behavior. The hope is that we are there to help and that the good in people will outweigh the bad behavior. I think we as nurses have this ideal that we are helping people, and in turn, people may be ungracious, but not violent. Well, I think the statistics would show that it doesn't matter. Yes, we do want to care for people and we do want to help them, but if you've been around people for enough time, you understand how some of them behave. And some of that is not ideal, and it can be unfair, it can be mean, but this is how people are. The third question that was posed and where nurses provided additional detail was, should nurses in hospitals expect to be exposed to patient violence while at work? Now, remember, the results to that were 32% said yes and 68% said no. So let's dig into the responses of those who said yes. They said it's because they are caring for human beings and humans are not perfect. This is why nurses should expect to be exposed to workplace violence. And it's because it's a very stressful environment for a patient for multiple reasons. Not only are you sick, but there's other factors like unfamiliar environment, missed work, maybe child care concerns, and maybe money concerns. On top of that, you have issues with autonomy, independence, fear, grief, and trauma, and pain. They also talk about the altered mental status and mental health needs. They talk about the alterations in cognition or mental status, and those are cited as reasons nurses should expect to be exposed. And they say, if you're working with these types of patients, you should expect the potential for violence. They also say it is reality. It is real. It happens. They say it is an unrealistic expectation to think you won't get hit. And they talk about exposure to patient violence was perceived as an inherent part of the job. And since it is going to happen, nurses should be prepared to deal with situations. They also go on to say that we need to be prepared. And by being prepared for potentially violent patients, there is an awareness and a plan that can be followed to prevent injuries. And they also go on to say, if you don't expect that patients can become violent, you can't protect yourself and you can't appropriately care for that patient. They also say, yes, we should be expected to experience workplace violence, but they say it's easier to keep yourself and your coworkers safe if you have an awareness of the possibility of violence, but it should not be near as common as it is. And they talk about in an ideal world, it should not be an expectation, but I would say that, yes, it should probably be expected so that at the very least, nurses aren't surprised when it happens. They also go on to say nurses should expect to see violence at work, but it is also essential that they be given training on how to handle aggressive patients. And another one says, I hate that we should anticipate it, but in anticipating it, we learn how to protect ourselves. And finally, they also say, I don't want to expect it, but I want to be prepared to handle patient violence if it occurs. How I read this and how I hear the comments, there is some acceptance of, yes, this is the reality. I wish it wasn't so, but unfortunately, it is a reality. They also go on to say, I think we should expect it, but it is something that is realistic to expect. That doesn't mean it's a good thing or that it should be tolerated, but it is a real possibility. And another one said, it should never happen at work. However, that's an impossible expectation to have. And lastly, on this, they say to not have any violence would be grand, though it is unrealistic. Not saying that it's okay, not saying it is going to happen every day, just be on alert. And remember, 68% of the respondents said no, that nurses should not expect to be exposed to violence while at work. They say no one should be expected to be exposed to violence, but no one shouldn't be surprised when they encounter it at work or in a hospital. They also say nurses should not have to fear for their safety, but it is understood that the risk of violence is ever present. We should all be prepared for potential violence, but never expect it. And I don't think nurses should expect violence, but should be mentally and physically prepared for the possibility of violence. They also say it contradicts reality. They shouldn't expect to be exposed to violence, but unfortunately we are. I don't think anyone should be exposed to violence anywhere, but it is part of being a nurse and working with patients that are possibly cognitively impaired. They also say, compared to the ideal, they should not expect to be exposed to violence at work, but we are not in an ideal world. And in theory, no one should be exposed to violence. While nice to dream about a job of no violence, it is never going to happen. They also talk about no one should expect to have violence happen at work. We have a right to work in an environment where we shouldn't feel at risk for violence. A hospital should be an area of safety and respect. They also compare it to other jobs. They say nursing should be as safe as any other career field, and no person should be expected to experience violence unless you work in an industry that has a lot of it. They talk about higher risk like law enforcement and things of that nature. Why should anyone at any workplace be expected to put up with and tolerate violence? We don't expect this of teachers or police officers, and lawyers do not go to work expecting to be attacked. Business people do not expect violence. And they talk compared to other situations. I would never allow someone in the street to walk up and punch me. Why should it be expected at my place of employment? They also say if a person hit you, spit at you, or verbally abused you out on the street or in a store, it is a crime. Just because we are nurses does not mean we should tolerate that kind of abuse. And then lastly, they talk about the status of being a helper or a caregiver. And they say nurses deserve to be treated with the same respect they treat their patients with. We shouldn't be exposed to violence when our job is to take care of people and get them better. And no one should be expected to experience violence at their place of work, especially those that are trying to help people. So I hope you found this further discussion of the 3 questions helpful. Stay tuned for the next episode where we will talk about the study's discussion and other incidental findings. That's a wrap for this episode of the Black Belt Nurse Podcast. If you enjoyed this episode, don't forget to like, subscribe, and hit that notification bell so you never miss a new episode. Drop a comment below and let me know your biggest takeaway. I would love to hear from you. You can find me on LinkedIn and Facebook, as well as blackbeltnurse.com. For now, be safe, and I'll see you in the next episode.